Ivotion as a definitive hybrid prosthetic. Just for the very reasons we had covered earlier, not just for the strength, because we are going to add a metal substructure in this, but also with the oral hygiene. It's very hygienic, very bacteria resistant. And that's what you need in a product when you're going to have it in there in the mouth for a very long time. Here is another fantastic way to use Ivotion. For example, we have a case where the patient's on a candidate for same-day teeth. They're not a candidate for same-day loading. It could be a situation where you have to graft first, then add the implants, or you're adding implants and grafting simultaneously, but the implants are not going to get the load values that you need. The Ivotion is not a waste as the temporary, conventional, immediate denture. What we're showing here is they're using that same design, that matrix, to help design the final zirconia case. This is a case of my own. That's actually what I did. I printed out the Ivotion, scanned it back in, and it gave me my try-in for my zirconia. So finally, how do we incorporate the Ivotion into your practice? You can do exactly what you have been doing as you were trained to do. Take your records. When you send these to Roe, they're going to treat your records the same way they've been treating them, but now they're going to incorporate it into the Ivotion system. So you don't have to change anything. You don't have to learn anything new. You can keep doing what you've been doing so well all this time. Here we go. You call up Roe. That's how you're going to get access to this product. There were no expenses involved. Zero. However, you could take some courses to improve your removable techniques so that the outcome is even better. Just a interesting fact is that just by using this product, going through your conventional records, the dentures are automatically going to fit 4 times better just by going through this process. And so if you're doing great records, it's going to be amazing, guys. It's going to be amazing. So there's no startup costs, which minimizes any barriers to incorporate the Ivotion to your practice. That's a big benefit. The increased patient satisfaction through the comfort, the strength, and aesthetics. Patients are looking for this. They're very savvy. They will get online. They are Googling for a better denture all the time. And if you're offering this, if you're advertising this, they're going to call your office. Now, this is the point that I was talking about earlier. This is, I think, a tremendous benefit to your practice is decreasing the post-op appointments. Opening your schedule to grow your practice or just to balance it. You know, we'll all strive to do 40 hours or less a week, but we're finding ourselves doing more. And one of the interesting perspectives on owning a practice or practicing dentistry is surprise visits, the emergency adjustment visits, the post-op visits for adjustments when it's taking more than 30 minutes. This will kill your schedule. And this is why sometimes dentists are kind of scared to get involved with dentures is because of this very thing here. It's the post-op visits. Ivotion helps you with that 100%. It's going to minimize those visits so that you don't have to worry. Let's take a closer look at the benefits, okay? And one last point I want to make with this is the confidence that you're going to have when treating patients with dentures and implants alike. It's a wonderful thing to know that you can tell your patient, look, this product does this. It's going to give you the aesthetics. It's going to give you the fit. You don't got to worry about this thing breaking on you. If you lose it, there's still no worries. You won't have to come back on all those visits for the records. And lastly, this is good for your oral health and your overall health because it's very bacteria resistant. So one of the more important benefits that you need to incorporate into your practice is the marketing of Ivotion. This is going to drive your patients to your practice because they are definitely looking for a higher tier denture, period. I can't stress this importantly enough, but the marketing aspect of the Ivotion is going to, not just by word of mouth, but also through the marketing aspect, will help drive the patients to your practice. It's going to be a tremendous aspect of your business once you start marketing this for your practice. Let's recap on the benefits of how Ivotion can transform your practice. On the profitability side, your clinical records do not have to change. What I mean by that is you don't have to go and buy special equipment to get started. So there's no initial investment needed. This second part is a beautiful thing. The adjustments of post-op visits is going to be reduced by 80 to 90%. 80 to 90%. We're going to go into some numbers what that really means. There's no startup costs. Period. You don't got to buy nothing new. You can just call up Road and get Ivotion started in your practice. You just have to prescribe it for your patients. Reduce visits depending on the technique. If you're doing wash impressions on your try-ins, it depends on what the scenario is and what you're shooting for your patients. But there are techniques you can do to also reduce the visits and have an outstanding result for your patient and aesthetics and fit. The other way of growing your practice, because this is a premium denture, guys. It's a premium denture. And in my opinion, that's the best denture. There is a fee adjustment for this denture. There is a fee adjustment that you need to incorporate into your practice. So it's not the same price of what you've been charging for the other dentures. You need to increase the fee with this. Patients will pay this, okay? Feel comfortable in charging more. Would you charge more? Up to you, but it's definitely a premium denture. I want to take the time to go back over the post-op visits. It's just that important. And if we go through the scenario of zero chair time for remakes due to a loss or unrepairable denture, and it's everything from them losing it to their dog chewing it up. Remakes take an average of 3 to 5 visits for the records. And if we average that out, it's about 6 hours of chair time. Chair time currently is about $800 of national average, which is the national average for dentists. So imagine saving that chair time, because you don't have to even do it. It's about almost $5,000 because you're not wasting that time and having to do it again, but you get to charge for that denture again. They lost it. There is a fee for service here. The convenience of being able to have that denture ready on hand and we'll give it back to you within a day or two is amazing. The downtime the patient has to be without teeth is minimal. If we looked at this, if you have one patient, which I know you have more than one, that walked in saying they lost a denture or something happened to their denture and you can't repair it, there's one patient a month. That would equate to somewhere around $60,000 in production and chair time. Just one person a month for doing nothing different. Let's go over post-op adjustment visits. So once again, we know that the national average chair time is $800 an hour. There's on average 3 to 5 visits in a 3-month period. Each visit is about an hour long. So let's chair time. So if we went on an average patient in a 3-month period, $3,200. So let's take a bigger number. Let's take 40 patients over a year. It's going to cost a practice to lose $128,000 of productive chair time every year. That's someone's salary or 2 people's salaries every year because of post-op visits. If we were to reduce that by 80%, the loss would only be $25,000 a year. In other words, what can you do with it on average every quarter by $25,000 or on a yearly basis over $100,000? What can you do with that cost? That it not being a loss. The chair time, what can you do with that? If you can use an additional $100,000 in your pocket every year for doing nothing different, but just prescribing the Ivotion, that's pretty amazing. And remember, this is in addition to opening chair time for new production. So this is on top of that. Okay, this is on top. If you decide I want to make more production because my practice is now growing and now have more open chair time, now you have it.